All right, so we are joined all the way from Columbus, Ohio, by Dr. Latonya Carroll. Has a resume that will rival anybody that we've had this semester. Nurse practitioner, specializing in pediatric and behavioral psychological health, right there in Columbus. Graduate of Central State University, great HBCU, as well as other degrees. We've got a room full here with us at Velma Jackson High School. We're in the Health Science Career Cluster, and we are recording this for our friends at Rosa Scott, Madison Central High School, Germantown High School, Ridgeland High School, the Academic Options Center, and our YouTube channel. So thank you again for taking some time out of your busy schedule for us today.
No problem. Thank you for inviting me.
Now, before we get into what you do and what all how you got to where you are, like we mentioned, you are a graduate of Central State University there in Wilberforce, Ohio. That is an HBCU. And then you went on to Case Western and Mount St. Joseph's, which are both private universities. So talk a little bit about, the decision to go to an HBCU, and then what led you to go to the PWIs after that.
Okay. So I knew I wanted to go to HBCU. I had offers to go to Ohio State, but I wanted to go to a HBCU and get that experience as far as being in a not minority situation, more of a majority situation. So I opted to go to Central State. I had applied to other schools, but I wanted to stay closer to home because at the time my son was about 3, 4, so I wanted to stay close to home. So I was able to do that and still go to school despite having a son in high school.
Oh wow, I did not know that. That's pretty impressive. Now, what led you to get into the medical field? Because I hear so many young people talk about they want to be a nurse, they want to be a doctor or whatever, just because they think automatically that's a lot of money.
Right.
And it can be very lucrative. You can make a very good living at it, but it is not like you see on TV. There is it is one of the most rigorous degree programs in the country. I don't care where you do it, whether you do it at community college, whether you do it in the military, or you do it at a university. It is extremely difficult. But I was telling the kids, it's recession proof, it's pandemic proof. It's always going to be in demand, but it's not just something you just wake up in one morning and say, hey, I'm a nurse.
Right. So I started out my senior year in high school. I only needed 2 classes to graduate. So I did the clinical laboratory technician program at the Career Center. And I did that in the mornings. And then I would do my 2 classes that I needed to graduate in the afternoons. And so in that aspect, I kind of knew I was going to do something, in college, but not quite sure, because I also took classes for computer programming. So it was either going to be computer science or something in the healthcare field. And so I opted to get a bachelor's in biology. So I knew I wanted to do something in the healthcare field. Initially, I thought medical school, but I felt at having a young child, for me, it wouldn't be fair, because medical school takes a lot of your time, focusing and studying, and I didn't feel that would be fair for him at the time. So I opted to kind of look at whether medical school, nursing school, or something else. So one of my other things that I also had kind of enjoyed going through school and things was education. So I taught 9th grade science for a couple years. And then from there, when my son was a junior in high school, I went back to school to do the nurse practitioner program. But in between there, I did the nursing program at Mount St. Joseph.
Wow. Now, for the ones that may not be familiar, there are several levels in nursing, and several different skills required for nursing. And one of the cool things that I think about nursing is that once you get your foot in the door, you can work, but you can still go to school to advance your degrees, advance your pay, advance your responsibilities. Because for the ones that don't know, LPN, RN, or BSN, MSN, and then all the way up to nurse practitioner. So talk a little bit about the different levels, what's involved in that, and how you can achieve that as you move up the ladder in the medical field.
So what I've seen with a lot of students, they'll start out as a nursing assistant and, get a job doing that, whether they do it at a hospital or a long-term care center. And often, they get in mind, okay, I still want to do something else, but I want to be in healthcare, but I want to do something else. So a lot of times, certain hospitals will have programs. If you go to school to get a higher degree, they will pay for that schooling. So from there, a lot of students will do the, nursing assistant program, and then they'll go in and do LPN or RN. It just depends on where you want to go, because depending on the type of nurse, it depends on the length of the program. So a lot of the LPN programs may be 9 months to a year or so, or a little more. And then you have either your associate degree or BSN program. Associate degree programs are typically going to be 2 years, and they're often at community colleges. And bachelor's degrees programs are typically at your, colleges and universities. And you can, take a step and do the LPN program and get that under your belt, and then decide you want to do the RN program, and you can do an associate degree program, get that paid for, and have a lot of prerequisites done, and go to that next step. And then some people from there will even go from the LPN program, associate degree, and then do the bachelor's program.
Yeah, and then or in your case, the MSN, and then all the way up to nurse practitioner. Now, what is it? Now, what I know, but the kids don't know. What is the difference between somebody that's an RN, a BSN, MSN, all the way up to nurse practitioner? Because nurse practitioners can do a lot that the RNs and the LPNs cannot.
Right. So an LPN, they usually cannot do an assessment on the patient. They can give certain medications and things like that. RN can do a assessment on a patient, give medications, and then your next level up is going to be a nurse practitioner. And nurse practitioners can assess a patient, give medications, and write prescriptions. Yep. We can also do some minor in office kind of surgical procedures, but not big surgeries, opening up, open up people up. But we can do some minor in office surgical procedures.
Now, and along the same lines, one thing that went on for years, and fortunately it has changed. Nursing is not just a job for females anymore.
No.
There is a big need for male nurses across all areas, and that is for a variety of reasons. So talk about why there is a need for men to consider getting into nursing.
One of the biggest things that we look at in healthcare is that our population is not just female, and it's not just white, it's not just Black, so the goal in healthcare is to make sure we have people in healthcare related professions that kind of mimic the population of the country, because you want to have that diversity when you're dealing with patients. You don't want just one, kind of focus on patients. You want to have a whole different, kind of cultural outlook, and, people from different cultures, backgrounds, and things like that working with patients. And patients often want to see people that look like them. And I think if more men are in, healthcare related careers, more men may say, okay, well, if he's working there, it must not be too bad. I might go ahead and get that exam, because some men may feel more comfortable working with male providers versus a female provider. It might open up more, and may, say, okay, I'm going to go to this appointment because I feel more comfortable talking to this guy about my personal problem, medically, versus a woman.
Yeah, absolutely. And the whole, and it's the same thing with doctors having, there's a need for female doctors. So there's a need to diversify the entire field. Now, one thing you did mention is you said a lot of young people will get in the LPN program and they'll see other areas, or they'll begin the CNA program and they'll see other areas. There are a million jobs at a healthcare facility that is not a doctor and not a nurse. And especially in your case, we'll talk about that more in a minute, with the more technology driven, there's a need for technology professionals in in health science. So what are some of the other areas that are really growing now that, these kids should really consider getting into if they don't want to go to if they don't want to go to med school, or maybe, they like nursing, but they don't like dealing with the bodily fluids and all that stuff, but there's a lot of need for a lot of professionals. So what are some of these other areas that you're seeing?
So one of the biggest areas that has grown over the years is nursing informatics. And those nurses will work on the, getting things together for the technology part of, healthcare, because we're gone from that paper and pencil area where, everything was written by hand. we're into computers, and you got remote monitoring of patients, where a patient can be at home and do a blood pressure, and it's the provider gets that information automatically feeded. So that information is not just, okay, I'm going to read you these numbers. They are actually able to upload those numbers. Same thing with diabetics. They're able to upload those numbers from their glucometer, versus trying to write them all down and taking it to the provider and giving it to the provider. That information can be uploaded to the provider and then uploaded into the patient chart automatically. And then that way, all of that is together, and it's not a whole bunch of paper pencil things getting lost and things like that.
Yeah, and one thing that I've noticed just in the last few years is that the technology people in the hospitals are just as important as the doctors and the nurses, because these machines are running on new technology. The records are running on new technology.
Right.
You cannot lose that. If somebody needs a medication to save their life and the system goes down, you're in a lot of trouble.
Right.
And also there's a lot of behind the scenes people. There's people in the pharmacy mixing the drugs, mixing the IV bags. There's people that have to analyze the things that are at the samples. When people have to give urine samples and blood samples and tissue samples, there have to be people to analyze that. So it's not just the patient, the one-on-one patient care.
Oh.
There are a lot of very important jobs in these areas. And I'll tell you, during COVID, the biggest premium for a job was a respiratory therapist.
Yeah.
So respiratory therapists right now are probably the hottest job in healthcare.
Right. And most of that was, they, needed the ventilator type systems, but we look at nursing and it's all, in hospital care and things of that nature. And it's not, there's a lot of jobs that, nurses can have that they don't even have to have any kind of patient contact, and they're still, needed. Educators, yes, you have to go to nursing school and, to be a nurse educator, but nurse educators don't have a lot of hands-on patient care, except if maybe they go to a hospital for clinical. And you have, we need nurses to do research, informatics, and those are the ones that's going to do work on the computer systems and the health records and get those to the, you got to have your case managers, legal nurse consultants. If there's a, malpractice case, they will have nurses, look at the charts and look at everything and kind of, give advice as far as what they found from that chart and everything. And then you have, nurses who write books and things like that, and because we need nursing books, so you got to have a nurse to write the books. So
yeah. And the coolest thing about nursing, and honestly, any of the non-MD medical jobs, is that when you become a doctor, that's great, but you're stuck in that specialty for the rest of your career. Nurses, if you get bored doing something, you can go move to a different specialty and do a whole different type of patient, a whole different type of care. And the cool thing about health science is that if you're a person that wants to work overnight and you're not a morning person, they need night people.
It's 24 hours.
They need, or if you're a morning person, you want to be off at 2:00 in the afternoon, there's people that need that. So it really is, you're not going to be stuck in a 9 to 5. Now, if you want a 9 to 5, there's the 9 to 5, at the dermatology clinic, they need nurses and they at 4:30 every day, but it really is one of the most flexible careers that I know of.
It is. In the hospital, you have your oncology, psych nursing, cardiac nursing, and then outside the hospital, you'll have your public health nurses, home health nurses, the school nurse, and then you have nurses that work in occupational health, where someone may get injured on a job, they'll go into the clinic and be seen for occupational health and things of that nature. So you don't have to be in a hospital. You don't have to necessarily do non-patient contact. You can just do some, different clinical positions, but it's not in that 24-hour hospital setting. 9 to 5, 11 to 7, it's really flexible with a lot of the different specialties.
Yeah. And the other thing is, you can have the full-time job at the hospital, but you can work part-time in a nursing home. You can work part-time at a veterans home. So there's a lot of opportunity there. Now, before we talk about your clinic, one thing I really wanted to mention is that, so many of these kids, they say they want to get into this because, like we said, they think it's good money, and it can be. But the most important thing I want these kids that are here with me and to see this later to realize is that health science is not something to be halfway in. You
No.
have people's lives at stake. You have people's family at stake, people's livelihood, people's full-time health. So this is something, it needs young, hungry people that are full of energy and ready to learn, but it's not
Right.
something to just do as a fallback position.
No.
So talk a little bit about some of the things that you've seen on that, because I know you see it all the time.
Well, I taught nursing at the associate degree level, bachelor's degree level, and master's nurse practitioner level. So a lot of times as an educator, you know, we often see you know, different things that students do. And it's, you know, my thought in my mind, I don't want to sign off on a student's, you know, saying they did well in a class or a course, and knowing that the end result is they'll have to take care of someone, you know, later. And what I'm always thinking, what I want that person taking care of me, especially if they're cutting corners and doing things like that. I wouldn't want that person taking care of me, and I don't feel that they should take care of another person if they're not going to, you know, put in the work. And you know, when I did the BSN level, students will go hang out the night before and want to come to clinical, and they're tired and groggy, and, you know, go drink some coffee, figure it out, and get it together, or you have to go home because you can't take care of a patient if you're not ready.
Yep.
And you don't want to, and you don't, if you're tired and things of that, or even sick, you're going to make mistakes. And those mistakes aren't just going to be a mistake because, oh, you just forgot a time. That time for that medication might have been important for that patient's life.
Absolutely. And I just think, you know, I cannot stress that enough, that, you know, this field needs people. It needs young people. It needs all kinds of people. But this
Right.
is something that, you know, you literally have somebody's lives in your hand.
Right.
You know, and I know we all watch the TV shows and those are all drama, but, you know, unfortunately, stuff like that does happen. You
Right.
know, people, you know, they fall asleep at the wheel and they miss something, and it can cost somebody their life.
Right.
And so it's important to understand that if you want to get into this, that's the kind of standards you will be held to, no matter where you go get the education.
Right.
Now,
Right.
before I get to the questions, we got to talk about your clinic there in Columbus. Telehealth is the, you know, the new thing, and you do just a huge variety of practice, and you're licensed in 15 states to do practice, and you do mental health, behavioral health, injury rehab, pediatrics. So talk a little bit about how this came about and what all you do.
So one of my first jobs after becoming a nurse practitioner was working at Minute Clinic. And pretty much in those clinics, it's just like CVS, and you're running a clinic by yourself. You check the patient in, you check their insurance, you do the, you know, care, and then do everything, and then you send them home. And so I kept thinking to myself at that time, I can do this my own self. So the goal was to end up doing my own clinic. And, you know, in the back of my head, that was in 2012. And so that's what I'm thinking. And so it got to be maybe 2019. I got a call from someone in Maine. They saw my name on a list that could provide care for patients with addiction. And they called me and asked that I want to help. So of course, I'm not going to Maine. So, you know, that's how the telemedicine came about. You know, and so my first telemedicine program was working with patients with addiction. And working with those patients, I found that many of them didn't have primary care providers. They only saw me. And so with having the family nurse practitioner certification, at the time that I had the family certification in pediatrics. So I was like, okay, well, maybe I need to do something in that aspect to help those patients who don't have primary care providers, but they still have high blood pressure, you know, diabetes and things of that nature, and need someone to take care of that. And so that's how I came up with the telemedicine clinic overall, in doing that, especially with that population of patients, but not just for that population of patients.
Yeah, and especially with now with COVID, we become more and more virtual. There is a huge market for telehealth, especially if people are disabled and cannot
Right.
get out, or
Right.
if they're in a rural area and there is not anybody near them that they can go see. There
Right.
is a more and more need for that, and to have it in 15 states is just really amazing.
Right. Yeah, and like I said, that's what happened with Maine. A lot of those patients, even though I see them on telehealth, they still have to go to a site in an office, and they sometimes travel 2 to 3 hours just to talk to me for about 15, 20 minutes once a month.
Yeah, but then in rural America, there's people that have to drive even farther than that to see a
Right.
doctor. So that's still a
Right.
huge convenience and a huge need. Now, I always think it's funny. I had a guest last year who's a local doctor here in Jackson area. She's actually the only Black pediatric GI in the state of Mississippi.
Right.
And she opened her own business, and she said,
Right.
the thing is, in medical school, they taught me all about how to take care of a patient. They did not tell me how to run a business. So
Right. And
yeah,
yep.
it's a whole different ball game, because you can be obviously in health science, you can be a fantastic employee and make a very lucrative living as an employee.
Right.
But running a business is a little bit different monster.
Right. Yeah. I have to make sure the, electric is paid, the gas, and make sure deposits are made, and make sure the billing for the patient is, submitted, because right now, it's just me. So I have to make sure everything is done, make sure I submit the billing so I can get the money to pay and make sure the lights and things stay on. So, it's definitely been a learning curve in that aspect. I mean, I wouldn't, at this point, I don't think I could go back and work for a 9 to 5, work for someone, because I have so much more freedom and, with my time and everything, but it's still been a learning curve in the business aspect of running the clinic.
Yeah, absolutely. And that would be in any field, but especially in healthcare, because when you get that healthcare certification, they're going to spend all that time to get you ready to be a great healthcare professional.
Right.
So I would say if anybody wants to do that, they at least take a couple of business classes to kind of be familiar, or even get a business minor if you're doing the university route, because that I'm telling you that nobody's going to teach you that.
If I would have known that a couple years ago, I definitely would have did it that way. But a lot of, they teach us to, that we're going to go work in a hospital or work in a clinic, and we're going to work for someone and not push towards working for yourself.
Absolutely. Well, I got some questions from the students. I'll get to as many of these as I can.
Okay.
The first one is Michaela Davis. She's a junior and actually wants to be a doctor. But this is a good question. She asked, what was the most stressful situation you have ever encountered as a healthcare professional?
I don't know, because I'm usually not very high strung as far as things go. When patients would code, if it wasn't my patient, I would make sure everybody else was stable. But I would say one areas where I had the biggest concern is I did have a patient that had surgery, and she had some swelling from her surgery, and making sure we got her airway open. And I think that was the biggest thing, because I'm like, I don't want her to die in the room, so we got her stabilized so she can go to the ICU. But I think that was the biggest thing, because in most aspects, right now I'm in the clinic, I don't have those things happen anymore.
But yeah, but it's one of those things, once you get your foot in the door and you start getting that experience,
Right.
you got to use that training to be on top of it. But yeah, that would be the hardest thing. But you learn how to deal with that in your training. This is Rashawn Smith. He's a sophomore, and he asked, what piqued your interest to get into healthcare?
I guess it was more so working with people. That was one of my biggest things. And I got an opportunity I wanted to work with people, but I also liked teaching. And so I started teaching, and then I went into nursing, and then I found that I can do them both. So it was more so wanting to, help people and keep people from being in, situations where they die over things that are regular maintenance things, if they had a primary care provider that they could have taken care of, versus waiting to the last minute and they're in the hospital setting.
Yeah, and it really is, like we said a few times, this is a field that's always going to need people.
Right.
So especially with all the technology changing and all the people living longer, it's just always going to be more professionals. This is Nisbeek Johnson. He's in 9th grade, and he asked, what are some tips you would give a kid that wanted to get into medical and into the medical field?
So the first thing is, volunteer at different places that, that have opportunities for you to volunteer, shadow, when you get to college, do internships. A lot of the colleges in the summer have programs where students who are interested in medical field, they can do like sometimes 3 to 6 week programs where they will do like physician things or things like that. And you learn different areas and so you can decide what specialty you might want to specialize in. And then even with nursing, find out if they have volunteer programs to shadow. I shadowed at Ohio State, for, to kind of decide if that was something I wanted to do. It wasn't hands-on patient care, but it was an opportunity to see the different areas and how things worked in the hospital and how things flow. Unless you're by the ICU or emergency room, there's nobody running down the hall.
Yeah.
No.
Yeah, I mean, I don't think people, I mean, we see all the medical dramas, but it's not like that. You really have to get in there and see it for yourself. This is Rashunta Pierce. She's in ninth grade, one of our basketball players here at Velma Jackson.
Okay.
And she asked, what is the most rewarding part of your job?
One of the most rewarding parts of my job is, and I had an opportunity to see that, is when you find something and you help a patient and, they don't know what's going on. You don't know what's going on, but you find a way and you help them. Had a patient, she thought she just had a cold and she actually had leukemia when she came in. And she just she just couldn't feel better. She looked sick, but on the outside, you can't tell it's leukemia. And if you don't kind of, use critical thinking skills to say, what else is going on, I drew her blood, had her blood drawn and, had it checked. And she was able to go to the hospital. I always follow up if I have a patient I have to go to the hospital. And I called the house and her daughter asked, was I the lady that told her to go to the hospital? And I said, yeah. And she said she has leukemia. She has to be in the hospital for 6 weeks.
But, being able to catch that before it killed her, you just got to be such a great reward to save somebody's life. This is a great question. This is Gabriel G. He's a junior, one of our baseball players here. And he asked, how do you evaluate success as a nurse?
As far as success, more so as far as if I'm thinking about myself, is what impact can I have on others? And not necessarily money wise. My biggest goal is to, get more minorities. And when I say minorities, I include men because men are underrepresented minorities in nursing. And healthcare. Nursing is 80% white female. So we need white male nurses, Black male nurses, other nationality male nurses, and more minority nurses in general. So my success is seeing that I have influenced someone to, do well. And I always feel good when I see students that I have taught, come to me and say, I took your class and they're nurse practitioners now.
That's awesome. Yeah, that's and that's a great point because, like we said, the country has changed in the last, even in the last 10 years. They're really pushing men to get into this because there is a huge need for male nurses. This is Jarvis Lyles. He's in ninth grade. This is a great question. He asked, "What challenges do you see coming that will happen in the healthcare industry over the next few years?"
The biggest issue, and we are seeing it now, and it's starting to pick up and get better, is mental health. And partly, we don't really think about it, but COVID gave a lot of people PTSD. We think PTSD is a violent kind of, bombing or thing like that, but anything that kind of disrupt your normal, and it can cause some PTSD. So a lot of people are dealing with depression because of that. And right now we don't have enough mental health providers. And so there's more there are more students that are trying to get into mental health, but then you don't have enough providers to for them to do their clinicals, to shadow that they need in order to test. So that's going to be the biggest challenge going forward, is getting enough mental health providers for people going forward.
Wow. I never thought about that. That's a great point. I just got one more from the students. This is Jayla Chambers. She's in ninth grade. Okay. And she asked, how do you keep up with the changes that keep happening and that are going to happen in the medical field?
I mean, you have to just keep doing, we have to do CEUs to keep our licenses and certifications. Yep. We have to, for my nurse practitioner certification, we have to have 100. We have to have 100 CEUs. 25 of those have to be in pharmacology for medication.
Wow.
And so we have to have that done. And then for each, that's for my just my nurse practitioner, the family nurse practitioner certification. Pediatrics and mental health, they have their own, and each board of nursing has their own set of rules as far as the CEUs that you require. Some require specialty ones where like Florida requires HIV and a couple other ones. Ohio has a state law requirement that we have to fulfill. So each state has a set. You know, your certifications have a set.
Wow. So yeah, and it's one of those I hear people say all the time. I have, I have young people tell me, "Oh, I'm going to be a nurse. I'm going to move to Texas." Well, you got to get licensed in Texas before you can just up and say, "Here I am." So there is that licensing requirement that goes along with it, and it does vary from state to state. You got to know what you got to know.
The good thing is now they have the compact nursing, where you get, if you're licensed in a state that has a compact. So Ohio just became part of the compact in on January 1st. So if you're living in a state that is a compact state, any other state that is a compact state, you can work in. You just have to show that you are licensed in your state of licensure is in a compact state. So with that license, I could go work in Texas. I can go work in Maryland. I can work in Virginia, Colorado, New Mexico, Iowa. So all of those different places I can work with that. And I can't remember how many total now because they just added some more. But any of those states, all I have to do is show my license from, my primary state that I live there, and I can apply for any job. And that's been beneficial for traveling nurses when we had that nursing kind of shortage during COVID. With that compact license, nurses were able to go to different states and not have to apply for a new license. Some states that probably won't ever even part of California, probably will never do it. But those states you would have to apply individually. But a lot of states have joined the compact, and that's helped tremendously in getting nurses into those states that have a lower number of nurses.
Wow, I did not know that. That's incredible. Now we're almost out of time, and we thank you so much for joining us.
No
but
problem.
before we go, you had a kid when you were in high school. You are, you grew up as a young Black girl in Columbus, Ohio. I've got a room full of young Black kids who hear me right now. So you obviously had some things stacked against you at a young age, but yet you are a great example of becoming successful and becoming a leader in your field. So it can be done, despite all the obstacles you're going to face. So even if these kids don't want to get into in the medical field, they're going to face the same obstacles that you faced. So what can they do now to follow in the footsteps of a great professional like you?
The biggest thing is, don't take no for an answer. Don't take, okay, this, I don't have childcare, find a way. You find options. Okay, if you don't have childcare, maybe you have to do some online coursework, and then maybe find someone for 2 hours versus 8 hours. Just to go on campus to do some work in a lab. For whatever profession. But the biggest thing, like I said, is you gotta have determination. I was determined that I didn't want to sit at home and collect a couple dollars a month. I wanted to go out and I wanted to help people. Somehow, some way I wanted to help people. And I can't do that if I'm sitting at home. I had a child in high school and now there's nothing I can do. I can't go anywhere. No, I didn't want to do that. I had always had a goal to go to college. Yeah, it was a little bit harder, but I still was able to go to college. I still participated in different activities. I was in the marching band. I was a student ambassador, so I still got, some of that college life, even though I had a son in high school.
That's awesome. Well, so, I mean, just such a great inspirational story, and just doing, really pushing the buck there in the Buckeye State. No pun intended on that. So, but again, Dr. Latonya Carroll, all the way from Columbus, Ohio, thank you so much for joining us. We really appreciate it.
Thank you. Thank you for having me.
All right. Talk to you soon, my friend.
All right. Thanks.